I'm going to be inserting and removing a nasogastric tube in my patient. So first and foremost, I would check with for 2 patient identifiers, make sure that I have the correct patient. I will get my tube ready. So we will get our tube ready. I will raise my patient up to a comfortable position, put him in a sitting high Fowler's, put a pillow behind him if needed, and measure. First, we will measure from the tip of the nose to the earlobe to the xiphoid process. We will mark where on our tube with a piece of tape. Then I will put my gloves on. We'll place a pad on my patient. I will give them a cup of water to hold on to. And the other hand, they can have, we'll just set down here an emesis basin, and I will give them a tissue in case their eyes water and they need to wipe their eyes. I will take my tube, coil about 5 or 6 inches around my finger tightly, and then release. Then I will take about 4 inches and lube it up, nice and lubed. And then I will take just below where the lube is, I will take the round part. I'm gonna hyperextend their neck just ever so slightly, and we will insert into the nasal cavity passageway that is closest to me, and we are going to go along the floor of the nasal passageway towards the near ear. So we will insert, and as we approach the back, I may feel resistance. I will apply slight pressure, but not forcing it if it doesn't go. And once we pass through the nasopharynx, we will stop. I will have my patient sit up and take their water because they're going to need to take a couple sips for this part. I will have them put their head up just a little, chin down, and I will ask them to take a couple sips. And as they swallow, I will advance my tube 1 to 2 inches with each swallow. Swallowing. I will rotate it 180 degrees so that it slides back to where it needs to go, all the way until we reach our tape. Then we will secure it with a piece of tape on the nose and wrap it around our tube. We will now that it is secure, we will check placement of our tube by 2 ways. We will use a tongue depressor, and we will check in the posterior pharynx to make sure that it is not coiled up in there. We will aspirate the stomach contents, pulling out some stomach contents. We will test the pH of our stomach contents, make sure that it is from the stomach. We will note its color, consistency, and the amount of how much we pull out. If we are in the stomach, I will make sure that they can speak. Can you speak?
Mm-hmm.
Okay.
Yep.
So I would clamp this off, or I would hook it up to suction. So we hooked it up to suction. I will then make sure we would use an external nasal fixation tape device. And I would make sure that it is marked on my tube where it is inserted to. We will then secure it to, we will loop it, put a piece or a rubber band on it, and secure it to the patient's gown with a safety pin. And our patient is good to go. I would lower them down to a comfortable position, leave them at about a 30-degree angle unless contraindicated, and make sure that they have their call light.
Yippee!
Now we are going to remove said nasogastric tube. So to move it, I would sit my patient up into an upright sitting position. We would put a pad on them. I would give them a basin in case they needed it. I would be sure to have my gauze and a towel ready to put it in. We will get our biohazard bag to place it in when we are done. If it is hooked up to suction, I will stop it, and we won't remove it no sooner than 30 minutes after the last tube feeding. So I will let them know that this is going to be brief. We are going to detach from the gown and take the tape, unsecure that. I will put my gloves on. Make sure that it is unhooked. We will inject 10 to 15 mLs of air or saline or water, whatever is wanted. We will push that in. We will get our tube coiled up. I will ask my patient to take a deep breath and hold it as I go ahead and pull it out. Deep breath and hold. As we pull it out, coil it up like so, and then throw away into our red bio bag. Clean the patient's nares. We will get that cleaned up. If it was hooked up to suction, I would chart the amount, the color, consistency, and dispose of all of my suction tubing and equipment properly. Before we removed it, we would make sure that there was an order to have it removed, and then do so.